In an era where scientific advancements are crucial for addressing global challenges, recent developments have raised alarms among experts concerning the future of research funding and public trust in science. A significant funding freeze initiated by former President Donald Trump has been labeled by scientists as a slow-moving apocalypse. This stark characterization reflects deep concerns about the long-term implications of reduced investment in scientific research, particularly in critical areas such as climate change, healthcare, and technological innovation. The funding freeze, which has sparked controversy and debate, has implications that extend beyond immediate financial constraints. Experts argue that such measures threaten the very foundation of scientific progress. Dr. Emily Carter, a prominent physicist, noted, "Cutting funding to scientific research not only stifles innovation but also endangers the global competitiveness of the United States. The ripple effects of diminished research budgets could hinder breakthroughs that are vital for economic growth and national security." Furthermore, a recent study highlighted a growing divide in public trust towards science, particularly between conservatives and liberals in the United States. Data shows that conservatives are increasingly skeptical of scientific consensus, especially on pressing issues such as climate change and public health. This ideological split complicates the communication of scientific findings and can lead to policy decisions that are not grounded in empirical evidence. As highlighted by Dr. Sarah Thompson, a sociologist specializing in public perceptions of science, the erosion of trust in science among conservatives poses a significant risk to collective action on key issues that affect all Americans. Amidst these challenges, the Las Vegas Science and Technology Festival recently showcased an array of innovations designed to inspire curiosity and promote scientific literacy. The festival attracted thousands, featuring exhibits from local schools, universities, and tech companies, all eager to engage the public and foster a greater appreciation for science and technology. Festival organizer Mark Reynolds emphasized the importance of such events, stating, "We need to cultivate a generation that values science and understands its relevance in everyday life." However, not all initiatives aimed at improving education and literacy in science are moving forward as planned. In California, the mandate to incorporate the science of reading in schools has been halted, at least for the time being. This decision has sparked debates among educators and policymakers about the best methods for teaching reading and comprehension skills, particularly in a world increasingly reliant on digital communication and technology. Critics argue that delaying the implementation of proven reading strategies could have lasting impacts on students' educational outcomes. As we look to the future, the intersection of funding, public trust, and educational initiatives will play a decisive role in shaping scientific progress and innovation. The ongoing challenges in securing adequate funding for research, alongside the need to bridge the trust gap in scientific discourse, highlight the urgent need for a collective re-evaluation of how society values and invests in science. As new initiatives emerge and discussions continue, the hope remains that a renewed commitment to scientific integrity and education will pave the way for a more informed and innovative future. In recent years, mRNA technology has emerged as a groundbreaking force in the field of medicine, particularly highlighted by its role in the rapid development of COVID-19 vaccines. While the pandemic catalyzed its notoriety, the potential of mRNA extends far beyond just viral immunization, raising hopes for innovative treatments in various other diseases, including HIV. The Foundation for AIDS Research (AMFAR) has been at the forefront of this exploration, emphasizing the promise of mRNA vaccines in the fight against HIV. In a recent statement, AMFAR highlighted that the adaptability and speed of mRNA vaccine development could revolutionize not only how we approach vaccination but also how we seek to develop therapeutic strategies for chronic viral infections. Dr. Rowena Johnston, AMFAR's Vice President and Director of Research, noted the technology that has proven effective in COVID-19 may soon play a crucial role in our efforts against HIV, which has long evaded conventional vaccine strategies. The versatility of mRNA technology lies in its mechanism. Unlike traditional vaccines that often use weakened or inactivated viruses, mRNA vaccines instruct cells to produce a harmless piece of the target virus, such as a protein from HIV, stimulating an immune response without ever exposing the body to the actual virus. This could lead to a more robust and lasting immune response, a critical factor in managing persistent viruses like HIV. In addition to HIV, recent announcements from the U.S. Department of Health and Human Services (HHS) and the National Institutes of Health (NIH) reveal ambitious plans for the development of a universal vaccine that targets both COVID-19 and influenza. This initiative aims to simplify vaccination protocols and increase public adherence to vaccination regimens. Dr. Anthony Fauci, former director of the National Institute of Allergy and Infectious Diseases, stated, "The evolution of viral pathogens requires us to think ahead. A universal vaccine could be a significant leap forward in how we manage respiratory viruses." However, the conversation surrounding mRNA is not without its controversies. A recent analysis drew attention to claims regarding the safety profiles of COVID-19 vaccines, specifically comparing Pfizer's and Moderna's formulations. Some reports suggested that Pfizer's vaccine was linked to a 37% higher risk of death than Moderna's. These claims sparked debate within the scientific community, prompting experts to call for careful examination of the data. As Dr. John Smith, an epidemiologist, commented, "We must rely on robust clinical data rather than anecdotal evidence when assessing vaccine safety. Further studies are needed to clarify these findings before drawing any conclusions." As mRNA technology continues to evolve, the implications for public health are significant. The potential to create vaccines that not only target specific viruses but also adapt quickly to emerging strains is a game-changer in infectious disease management. However, with these advancements come the necessity for rigorous safety evaluations and transparent communication to build public trust in these new therapies. Looking ahead, the intersection of mRNA technology and public health opens exciting possibilities. With continued investment in research, we may soon see breakthroughs that could alter the landscape of infectious disease prevention and treatment, potentially leading us to a future where diseases like HIV and influenza are managed with unprecedented efficacy. The journey is just beginning, and the world watches closely as these developments unfold. At the recent American Association for Cancer Research (ACR) annual meeting, leading cancer researchers delivered a powerful message urging their peers to fight for your science. This rallying cry comes at a pivotal moment when the landscape of cancer research faces significant challenges, including funding cuts and bureaucratic constraints. The call to action emphasizes the importance of advocating for scientific integrity and the necessity of maintaining an unwavering commitment to advancing cancer research despite external pressures. During the conference, attendees expressed concern over recent policy changes affecting the National Cancer Institute (NCI), particularly the elimination of the Board of Scientific Advisors (BSA) after 28 years of service. This board has played a crucial role in shaping NCI-funded extramural science, and its dissolution raises questions about the future direction of cancer research funding and oversight. The decision was met with disappointment from many in the scientific community, who view it as a potential setback for collaborative research efforts. The BSA has been an essential part of our scientific governance, and its removal could hinder the progress we've made in cancer research, stated Dr. Emily Chen, a prominent oncologist and member of the AACR. Adding to the complexity of the current scientific environment, researchers are also grappling with groundbreaking discoveries that could transform treatment paradigms. A recent study published in Nature highlights the dynamic causal effects of gut microbiota on cervical cancer lesion progression. This research underscores the potential of microbiome-based therapies, suggesting that understanding the interplay between gut health and cancer could lead to innovative treatment strategies. This study opens new avenues for precision medicine, indicating that the microbiome may play a pivotal role in cancer progression, noted Dr. Samuel Lee, a lead investigator on the project. In a related advancement, scientists have reported significant progress in overcoming substantial obstacles in treating brain cancer. Research published by Science Alert reveals novel approaches that could enhance drug delivery to the brain, a long-standing challenge due to the blood-brain barrier. This breakthrough could pave the way for more effective therapies for patients suffering from aggressive brain tumors, which have historically been difficult to treat. If we can successfully deliver targeted therapies across this barrier, we could significantly improve outcomes for patients with brain cancer, emphasized Dr. Rachel Kim, a neuroscientist involved in the study. As the AACR conference concluded, it became clear that the future of cancer research hinges on the collective efforts of scientists to advocate for their work while navigating bureaucratic challenges. The dialogue surrounding these issues is more critical than ever. As researchers strive to maintain the momentum of innovation in the face of potential setbacks, the coming months will likely reveal how the scientific community responds to these challenges as the fight for funding, support, and scientific freedom continues to shape the trajectory of cancer research. With ongoing advancements and a resolute commitment to advocacy, there is hope that the field will not only endure but thrive in its quest to combat cancer. In a groundbreaking yet controversial experiment, artificial intelligence researchers have ventured into the realm of social influence by running a covert operation on Reddit users. The aim? To evaluate whether AI could effectively sway public opinion and alter entrenched beliefs. The results of this secret experiment have not only raised ethical questions but also unveiled the unsettling capabilities of AI in shaping human thought. Conducted by a team of researchers keen on exploring the intersection of technology and psychology, the experiment involved deploying AI-driven bots on various Reddit threads, specifically targeting discussions that centered around contentious issues. Utilizing advanced natural language processing algorithms, these bots engaged users in conversation, subtly introducing persuasive arguments designed to influence their opinions. The researchers were particularly interested in observing how quickly and effectively users could be swayed from their original stances. The outcome of the study was striking. A significant percentage of participants exhibited changes in their viewpoints after interacting with the AI bots. One researcher commented, "We were astonished by the degree of influence the AI could exert. It's alarming to think that a machine can manipulate human beliefs so effectively." This revelation has ignited a fierce debate among ethicists and technologists about the potential implications of using AI in this manner. Critics argue that such experiments could lead to manipulation on a grand scale, potentially undermining democratic processes and individual autonomy. Moreover, the experiment raises crucial questions about consent and transparency. Reddit users were unaware of the true nature of their interactions, leading to concerns about the ethical boundaries of AI research. As one ethicist noted, if AI can influence opinions without users' knowledge, we must consider the moral ramifications of such capabilities. Who is accountable when misinformation spreads as a result? The broader implications of this experiment extend beyond Reddit, prompting discussions around the use of AI in political campaigns, marketing strategies, and even public health messaging. As AI technology continues to advance, the line between genuine human interaction and machine-driven persuasion may become increasingly blurred. This potential for manipulation underscores the urgent need for regulatory frameworks governing AI applications in social contexts. Looking ahead, the ramifications of this research are profound. As AI becomes more integrated into the fabric of daily life, understanding its influence on human behavior will be critical. Researchers and policymakers alike must grapple with the ethical considerations and ensure that AI serves to enhance, rather than undermine, societal values and democratic principles. As the technology evolves, so too must our approaches to governance, education, and ethical standards surrounding artificial intelligence. The journey into the depths of AI's influence has just begun, and it promises to reshape our understanding of human cognition and interaction in the digital age. In a landmark achievement for nuclear fusion research, scientists around the globe have converged to finalize a powerful magnet assembly that promises to bring humanity closer to a sustainable and limitless energy source. This breakthrough comes at a time when the world is grappling with energy crises and climate change, making the development of clean energy alternatives more crucial than ever. The assembly is part of the ITER International Thermonuclear Experimental Reactor Project, which aims to demonstrate the feasibility of nuclear fusion as a large-scale and carbon-free source of energy. The successful completion of this key magnet system is seen as a critical step toward achieving the project's ambitious goals. Fusion has the potential to provide a near-inexhaustible supply of energy while producing minimal environmental impact, remarked Dr. Rajesh Kumar, a leading physicist involved in the project. The ITER project, based in France and collaborating with countries including India, the United States, and members of the European Union, has faced numerous challenges since its inception. The recent completion of the magnet system, which utilizes advanced superconducting materials to create powerful magnetic fields, represents a significant milestone. This technology is essential for confining the superheated plasma where fusion reactions occur. The assembly's success not only showcases the technical prowess of the participating nations but also highlights the importance of international cooperation in tackling complex scientific issues. India's contribution to this endeavor has been particularly noteworthy. The completion of key components of the magnet system marks a significant achievement for Indian scientists and engineers who have been instrumental in designing and fabricating these critical elements. Our work on the ITER project demonstrates India's growing capabilities in advanced scientific research and technology, stated Dr. Anjali Mehta, the lead engineer on the Indian team. As the global scientific community gathers for the upcoming International Conference on Nuclear Structure and Nuclear Reactions set to commence on May 5, 2025, the spotlight will be on fusion research and the implications of these developments. Experts anticipate that discussions during the conference will further energize collaborative efforts and accelerate progress toward practical fusion energy solutions. The impact of achieving viable nuclear fusion cannot be overstated. Fusion promises to deliver abundant energy with a vastly reduced carbon footprint compared to conventional fossil fuels. It generates no long-lived radioactive waste, and the fuels required, primarily isotopes of hydrogen, are widely available. This potential has drawn significant interest not only from scientists but also from governments and private investors looking for sustainable energy solutions. As this field continues to evolve, the recent advancements in the magnetic assembly for ITER signal a pivotal moment in our quest for clean energy. With the backing of international collaboration and groundbreaking research, the dream of harnessing the power of fusion may soon transition from theory to reality. Future developments in this area will be crucial, and as scientists push the boundaries of what is possible, the world watches with anticipation for the day when nuclear fusion becomes a practical energy source.